I want to tell you about the dynamic maturational model of attachment. And this is a model that has been developed by Dr. Patricia Crittenden, and it's based on research with at-risk populations. People may not know that there is more than one model of attachment. John Bowlby developed the ideas around attachment, and then they went out into the world, and researchers and uh, academicians, I should say, did worked with them and developed new ways of thinking about them and expanded them. Okay. Now, Patricia Crittenden has done her work on families where there has been risk. So her model focuses on how we respond to danger. How do we get our attachment figure to stay close to us when we're in danger? It's been used in court assessments and is quite frequently used in court assessments here in the UK. I use it. And it's been researched across cultures. So it's been researched internationally and across many, many cultures. So the underlying premise of the DMM, I'm shortening the dynamic maturational model, it's the dynamic maturational model of attachment and adaptation. And the premise underlying it is that we all develop behavioral strategies to stay safe and to get protection from danger. That our main motivation in life is to get to maturity so that we can reproduce, and hence the survival of the species. So it's very important that we stay out of danger, and that we have protection from danger, and that we get comforted in order to keep ourselves safe. So the DMM tries to understand how the person protects themselves and how their strategy for self-protection develops. And there are a number of strategies, which I'll show you. So this is the model. This is the circumplex model. And the DMM is divided into A, B, and C. It's quite a complex model, so I'm not going to go through the whole 5-day course of it right now, and I'm not going to try to. But basically, what it says is that there are 3 basic ways of staying safe, okay? So Mary Ainsworth, who was a student of Bowlby's and a colleague of Bowlby's, and who did a major piece of research into attachment, went and studied attachment actually in Africa. And she wrote to Bowlby and said, I've got 3 groups of children. Okay. One group is absolutely perfectly fine. She was looking at separation and reunion. Okay. So infants and toddlers up to the age of about 18 months, 2 years, where they were separated from their parent, usually their mother, and then they returned. And she was looking at what happened on the reunion. And she wrote to Bowlby and said, I've got 3 groups of children. One group is perfectly fine. Their mothers go, they don't show much emotion or feeling. Their mothers come back and they don't show much emotion or feeling, but they're glad to see them and they greet them and they just carry on. I've got another group who's sort of okay. Their mothers leave and they get fussy. They protest. They don't like it. And when their mothers come back, they might also protest a bit, and they might also be a bit cross and angry, and sometimes a bit fussy. And then I've got a third group who really aren't all right at all. They come back, their mothers go away, and then when the mothers come back, they're very distressed and they arch their back and they don't want to be picked up, and they're angry with their mother, and they might even hit her. So John Bowlby said, well, let's not label these 3 different ways of thinking about attachment until we understand what they mean. So let's call them A, B, and C. And that's how this A, B, and C came about. So Pat's dynamic maturational model is divided into A, B, and C. And there are different kinds of A's, there's different kinds of C's, and there's different kinds of B's. Most of us will fit on this model from the midpoint, if we bisect the model horizontally, most of us will fit on it above that, okay? So we'll either go from sort of A3 across to C3. And so we'll go through there's 5 kinds of secure, B, secure. We now know these as avoidant, secure, and ambivalent, okay? And what we know about those children who looked perfectly fine is that they weren't perfectly fine. What they had done was they had disregarded their negative feelings. They had come to understand, not intellectually, but through their body and through the way that they were interacted with, that they needed to repress their negative feelings. So the negative feelings of anger, fear, and anxiety were pressed down so that they didn't show them, because showing them might drive their attachment figure further away.